Why women's microbiome health is different. Women's microbiome health has unique features because it is influenced by hormones, menstrual cycles, pregnancy, birth control, antibiotics, sexual activity, menopause, diet, stress, and immune function. The gut microbiome helps break down food, produce beneficial compounds, support the gut barrier, and communicate with the immune system. But women also have a vaginal microbiome, and this ecosystem is especially important. A healthy vaginal microbiome is often dominated by Lactobacillus species. These bacteria can help maintain an acidic vaginal environment by producing lactic acid. This lower pH makes it harder for many unwanted microbes to overgrow. Reviews on vaginal health describe Lactobacillus dominance as an important feature of vaginal microbial stability and local immune defense. This is why many women search for terms like best probiotic for women, probiotics for vaginal health, probiotics for pH balance, probiotics for UTI prevention, and probiotics for bloating. But the key message is this: the best probiotic for women depends on the goal. A probiotic for occasional digestive discomfort may not be the same as a probiotic studied for vaginal microbiome support. A probiotic used during pregnancy may not be the same as one used for antibiotic-associated digestive issues, and a strain studied for IBS may not automatically help with urinary tract health. That is why strain-specific science matters. Probiotics for gut health, bloating, and IBS in women. One of the biggest reasons women search for probiotics is digestive comfort, bloating, irregular bowel habits, abdominal discomfort, gas, constipation, diarrhea, and IBS-like symptoms. IBS, or irritable bowel syndrome, is common in women. It can involve abdominal pain, bloating, bowel changes, and discomfort after meals. Some probiotic strains have been studied in IBS, but results are mixed because different strains behave differently. One of the most studied probiotics in this area is Bifidobacterium infantis, now often referred to in some contexts as Bifidobacterium longum. A large multi-center clinical trial in women with IBS found that B. infantis was studied for symptoms such as abdominal pain, bloating, and bowel difficulty. Another PubMed review on IBS reported that B. infantis showed improvements in IBS symptoms and was associated with changes in inflammatory markers. This does not mean every woman with bloating needs this exact probiotic. Bloating can come from many causes: food intolerance, constipation, high FODMAP foods, stress, gut motility issues, hormonal changes, or medical conditions, but it shows why choosing a probiotic based on clinical evidence is more useful than choosing one only because the label says 50 billion CFU. For women searching online for best probiotic for bloating women, probiotics for IBS women, or gut health supplements for women, the most important advice is to look for the exact strain name on the label. For example, Bifidobacterium alone is too broad. Bifidobacterium infantis 35624 or Bifidobacterium longum 35624 gives more information. Lactobacillus alone is too broad. Lactobacillus rhamnosus GR1 or Lactobacillus crispatus CTV05 tells you much more. A good women's probiotic should be selected like a targeted tool, not like a random wellness trend. Probiotics for vaginal health and pH balance. Now let's talk about one of the biggest search topics: probiotics for vaginal health. The vaginal microbiome is not supposed to be sterile. It is an active ecosystem. In many women, Lactobacillus species help maintain a protective environment by producing lactic acid and supporting a lower pH. When this ecosystem becomes disrupted, unwanted bacteria may overgrow, and this can be associated with issues like bacterial vaginosis, odor, discharge changes, and discomfort. One important pair of probiotics studied for women's urogenital health is Lactobacillus rhamnosus and Lactobacillus reuteri. A randomized placebo-controlled study in healthy women reported that oral use of Lactobacillus rhamnosus and Lactobacillus fermentum significantly altered vaginal flora. Another randomized trial studied lactobacilli together with antibiotic therapy for bacterial vaginosis and reported improved eradication outcomes in that population. This is important because many women ask, can oral probiotics reach the vagina? The answer is not always simple. Some studies suggest oral probiotic strains may influence vaginal flora, but effects vary by strain, population, and health condition. For bacterial vaginosis, Probiotics are not a guaranteed replacement for medical treatment. BV can recur, and medical evaluation is important, especially during pregnancy or when symptoms are persistent. But strain-specific probiotics may be useful as part of a wider care plan under professional guidance. So, when choosing probiotics for vaginal health, look for labels that clearly list strains such as Lactobacillus rhamnosus, Lactobacillus reuteri, or clinically studied Lactobacillus crispatus strains. People often search are probiotic for vaginal odor, probiotic for BV, best probiotic for women's pH balance, vaginal microbiome support, and Lactobacillus probiotic for women. These are powerful, but the content must be responsible. A probiotic may support balance, but it should not be marketed as a miracle cure. Probiotics and urinary tract health. Urinary tract infections, or UTIs, are another major reason women look for probiotics. Many women experience recurrent UTIs, and repeated antibiotic use can also affect the gut and vaginal microbiome. One of the most interesting probiotic species in this field is Lactobacillus crispatus. A randomized, placebo-controlled Phase 2 trial studied intravaginal Lactobacillus crispatus for prevention of recurrent urinary tract infection. The research focused on women with recurrent UTI history and evaluated whether restoring Lactobacillus crispatus could reduce recurrence. This is different from taking any random oral probiotic capsule. It was a specific strain, delivered in a specific way in a specific study population. This matters because Lactobacillus crispatus is often associated with a stable vaginal microbiome. However, not all Lactobacillus crispatus supplements are the same, and not every product available online contains the strain studied in clinical trials. For women searching probiotics for UTI prevention, best probiotic for urinary tract health, or probiotics for women urinary health, the practical message is this: probiotics may be part of the conversation, but recurrent UTIs need medical attention. Hydration, appropriate diagnosis, antibiotic stewardship, sexual health factors, vaginal estrogen in postmenopausal women when appropriate, and medical prevention strategies may all matter. Probiotics are not emergency UTI treatment. If you have burning urination, fever, back pain, blood in urine, pregnancy, or symptoms that keep returning, speak to a healthcare professional. Probiotics during pregnancy and postpartum. Pregnancy changes the immune system, metabolism, hormones, digestion, and microbiome. Many women search for pregnancy probiotics. Best probiotic during pregnancy, probiotics for postpartum, and probiotics while breastfeeding. One probiotic with notable pregnancy research is Lactobacillus rhamnosus. A randomized, double-blind, placebo-controlled trial studied Lactobacillus rhamnosus during pregnancy and postpartum and reported lower postpartum depression and anxiety scores in women who received the probiotic. This does not mean probiotics are a treatment for depression. Postpartum depression and anxiety are serious conditions that require medical support. But the research is interesting because it suggests that the gut microbiome may interact with immune, inflammatory, and neurochemical pathways connected to mood. Lactobacillus rhamnosus has also been studied in the broader pregnancy and breastfeeding context, including research protocols looking at eczema and allergy-related outcomes in infants. Pregnancy is a time when safety matters. A probiotic that is fine for one person may not be right for another. Women who are pregnant, planning pregnancy, or breastfeeding should not choose supplements only from TikTok trends, Amazon rankings, or influencer videos. They should ask, which strain? What dose? What evidence? Is it appropriate for pregnancy? Has my doctor approved it? This is especially important because the supplement market in the US and UK is full of products that use broad claims like women's health, immune support, hormone balance, or gut reset. The best approach is evidence-based and personalized. Probiotics, yeast, and candida. What can and can't be claimed? Many women search for probiotics for yeast infection, probiotics for candida, and best probiotic for vaginal yeast. Here we must be careful. Yeast infections are often caused by Candida species, and they can require antifungal treatment. Probiotics may help support the vaginal ecosystem, but they should not be presented as a guaranteed cure for active yeast infection. Some laboratory and clinical research has explored Lactobacillus strains and their ability to influence yeast-related vaginal conditions. For example, Lactobacillus rhamnosus and Lactobacillus reuteri have been investigated for antagonistic effects against vulvovaginal candida in research settings. But laboratory effects do not always translate into guaranteed real-world clinical outcomes. This is why responsible content should say probiotics may support microbiome balance, but persistent itching, pain, unusual discharge, recurrent symptoms, pregnancy, or suspected infection should be evaluated by a clinician. Probiotics may help support a healthy vaginal microbiome, but they are not a substitute for diagnosis or treatment when infection is present. How to choose the best probiotic for women. Now let's make this practical. How should a woman choose a probiotic? First, choose by goal. For bloating and IBS-type symptoms, look for strains studied in digestive comfort, such as Bifidobacterium infantis or other clinically tested gut health strains. For vaginal microbiome support, look for strains studied in women's urogenital health, such as Lactobacillus rhamnosus, Lactobacillus reuteri, or Lactobacillus crispatus strains. For pregnancy or postpartum use, do not guess. Ask your healthcare provider and look for pregnancy-specific research, such as studies involving Lactobacillus rhamnosus. Second, check the strain name. A strong label should show genus, species, and strain. For example, Lactobacillus rhamnosus GR1, not just Lactobacillus blend. Third, check CFU at expiry, not only at manufacture. CFU means colony-forming units, but more is not always better. A lower dose of a clinically studied strain may be more useful than a very high dose of random strains. Fourth, check storage conditions. Some probiotics require refrigeration. Others are shelf-stable. Heat and moisture can reduce viability. Fifth, look for third-party testing when possible. This matters because supplements can vary in quality. Sixth, give it time, but be realistic. Some people notice digestive changes within days, but clinical studies often evaluate outcomes over weeks. If symptoms get worse, stop and speak with a professional. Seventh, do not ignore lifestyle. Probiotics work best in an ecosystem. Diet, fiber, sleep, stress, hydration, physical activity, and antibiotic use all influence the microbiome. For women, prebiotic foods can be especially helpful. Oats, onions, garlic, asparagus, beans, lentils, slightly green bananas, berries, flaxseed, chia seeds, and fermented foods like yogurt or kefir if tolerated. But again, food is not the same as a targeted probiotic strain. Yogurt may be beneficial, but it may not contain the exact strain studied for vaginal health or IBS. Common myths about probiotics for women. Myth number 1. The highest CFU is always best. Not true. Dose matters, but strain evidence matters more. Myth number 2. All Lactobacillus strains do the same thing. Not true. Lactobacillus rhamnosus GR1, Lactobacillus reuteri RC14, Lactobacillus crispatus CTV05, and Lactobacillus rhamnosus HN001 are different strains with different research backgrounds. Myth number 3. Probiotics cure every women's health problem. No, probiotics are tools, not magic. They may support gut, vaginal, urinary, immune, or pregnancy-related health depending on the strain and context, but they are not a replacement for medical care. Myth number 4. If a probiotic causes bloating, it means it is working. Not always. Mild digestive changes can happen, but severe bloating, pain, allergic reactions, or worsening symptoms are not signs to ignore. Myth number 5. Women only need probiotics for vaginal health. Also not true. Women may use probiotics for digestion, IBS, antibiotic recovery, immune support, pregnancy, postpartum, and general microbiome balance. Who should be careful with probiotics? Most healthy adults tolerate many probiotics well, but some people should be more cautious. If you are immunocompromised, have a central venous catheter, serious illness, severe pancreatitis, recent major surgery, or are taking immune-suppressing medication, ask a healthcare professional before using live microbial supplements. If you are pregnant or breastfeeding, speak with your doctor or midwife before starting a new probiotic. If you have recurring BV, recurring UTIs, recurring yeast infections, pelvic pain, abnormal bleeding, fever, or strong odor, Do not self-treat for months with supplements. Get evaluated. Probiotics can be helpful, but the safest and most effective plan is personalized. So, what is the best probiotic for women? The honest answer is, the best probiotic depends on the woman, the goal, and the strain. For gut health and IBS-like symptoms, some Bifidobacterium strains, including B. infantis or B. longum, have been studied in women with IBS symptoms. For vaginal health, Lactobacillus strains such as L. rhamnosus and L. reuteri have been studied for vaginal flora and bacterial vaginosis-related outcomes. For recurrent urinary tract health, Lactobacillus crispatus has been studied intravaginally in women with recurrent UTI history. For pregnancy and postpartum research, Lactobacillus rhamnosus has been studied in relation to postpartum depression and anxiety scores. The main lesson is simple. Do not buy a probiotic only because the front label says for women. Turn the bottle around, read the strain names, look for clinical evidence, match the probiotic to your goal. And when symptoms are persistent or serious, get medical advice. Your microbiome is not a trend, it is a living part of your health. If this video helped you understand probiotics for women, subscribe for more science-backed gut health videos, women's health microbiome guides, and simple explanations of probiotic strains that actually have research behind them. If you want to understand how your body really works and the benefits of probiotics, subscribe to this channel because we turn complex scientific topics into simple and powerful information that you can actually use. And if you found this helpful, share it with someone who cares about their health.